Hello, thank you so much for joining us on yet another episode of The Digest. My name is Francesca. Now, we're all aware that Zambia, like other countries world over, is faced with the deadly coronavirus pandemic. And the World Health Organization has continued to advise countries through the health ministries to employ proactive mechanisms to stop the spread of the virus. Today on The Digest, in partnership with AMREF Health Africa in Zambia, we'll look at some of the successes scored, the fears, the myths, and challenges since the day Zambia first recorded its case of coronavirus. Until now, we're now in the new normal. Since Zambia recorded its first cases of coronavirus in March 2020, government immediately put anti-COVID-19 measures. Masking up, observing physical distancing, washing hands with soap, and sanitizing as often as possible were some of the measures. 3 months down the line, analysis of the case records available gave various causes of death including kidney disease, advanced HIV, hypertension and heart disease, malaria, suicide, brain tumor, pneumonia, tuberculosis, alcohol abuse and sudden deaths with no known symptoms. Vivian Zakanga is AMREF Zambia Head of Country Programs.
When we first heard of the first case of coronavirus far away from Zambia, we thought we were hoping it would never get to our borders, but it started moving, and soon we reported the first case in Zambia. And at that particular point, there was some sense of worry because we were not sure if our health system could handle a pandemic, and so we expected the worst. And seeing how the northern countries had responded and how the pandemic was fast spreading, it was really a worry because we were looking at our capacity within the health system to be able to handle a pandemic. One, we know very well that we don't have sufficient human resource in our health facilities. So were they really going to manage this pandemic? How are we going to make sure that the cases are contained, the healthcare workers also are being looked after psychologically? Also, we know that we have insufficient funds. We have not managed to meet the 15% Abuja declaration. So the resources going to the health sector are not sufficient. And so all those were really worries, and we are praying that we do not see the health system collapsing.
Various stakeholders were concerned when the first cases of COVID-19 were reported. Dr. John Tembo is an infectious disease expert.
So when we heard about the first case, we were worried about how it would spread within the community, how it would affect those who are in particular our HIV patients, because those are fairly immunocompromised. So we were worried that it was going to cause a lot of fatalities in that particular patient group. As we've seen, the dynamics of the spread within our population have been slightly different, well, very different, I would say, from the way it's spread in Western countries and the morbidity and mortality they've seen there compared to the mortality we've seen here. Here we've seen far fewer mortalities, and the disease tends to be more mild with very few severe cases.
Persons with disabilities also had their concerns. Already, there is more to be done in the health sector regarding the well-being of patients with special needs. Wamundila Waliuya is the director, Disability Rights Watch.
The first thing which came into my mind as a person involved in strategic advocacy when I heard of COVID-19 was the issue of having a health system which seems to be a failure to persons with disabilities in terms of accessibility, information and care, was the issues of the protocols which are brought in place, especially the social distancing or the physical distancing, when persons with disabilities who in the majority require personal assistance. For example, people who are blind, require a personal assistant when moving around. People with physical disabilities require to be supported by another person when they're using their mobility aids, and then those children with cerebral palsy or multiple disabilities.
What is your role in fighting COVID-19, and what is it that you have done?
Yeah, we have interacted with a lot of organizations of persons with disabilities. We have visited the Ministry of Health. They are all complaining that the Ministry of Health has not been responding to them. Slowly, the Ministry of Health, I'm told, responded. The concern is the materials that we are still within government stores or somewhere in the ministry.
Coming to AMREF, how we've supported this response, or generally the civil society organizations, I think there has been, the civil society have played a role of ensuring that resources are being used in the intended purpose, so there's an accountability aspect coming in, but also civil society organizations are complementing government efforts in the provision of services. And so we are seeing, particularly for AMREF, supporting the trainings in terms of infection prevention and control for community health workers and community health workers and healthcare workers. We are also seeing supporting the dissemination of information. In Zambia particularly, we've focused on the marginalized groups, people with disabilities. AMREF Health Africa supported the Ministry of Health to print IC materials on COVID in Braille, and we are currently also working on a DVD in sign language for people with hearing impairment. So the civil society organizations, non-governmental organizations have continued to support the government in the participation in the National Task Force meetings and also providing input. And also there are a number of subcommittees that have been put in place where we are able to fit in and based on our capacity to be able to support the response.
Frank Harley, who is the director at Strong Minds, an organization whose focus is mental health, shares his views about how COVID-19 had so many questions around it.
So we've had to pivot completely away from working in the community directly to offering a teletherapy, so a remote-based therapy counselling, which is brilliant. It means that we can safely do it whilst there's the risk of serious COVID. Now, obviously you can still wear masks in the community and we can protect it, but when there's 12 women talking about a very sensitive issue, maybe it's, for example, a rape of themselves or their child, you can't easily social distance. It's not practical, you know. Us, it's very easy, journalists, to have this distance. I'm actually a huggy person, so it's actually hard for me. But like even in the communities where we work, just to say, oh, and here's a tissue, maybe a tissue to help, it's not going to work for now. So we've had to very quickly respond, and I love your question because that doesn't mean there's no depression. There's probably more. Statistics are still coming in, but yes, so we've moved to an approach where we're bringing, anybody can call in and we're giving them a group therapy, so it's twice a week for 5 weeks. We will treat depression to the same standards as before.
There have been a lot of myths surrounding COVID-19 because of the differences in the prevalence compared to other countries. Others still don't believe that it exists.
So like one kama tae mu Zambia mwenzeli billet COVID-19 ni government chabe like it is related like a liver collapsion ale COVID na konka malamulo. Nyo papa COVID.
The same with like kuifutikira I don't know, you can say it, you can just put your blanket, put some leaves like our ward people used to do, and then that will cure.
Singa sevens, unless you just use sanitizer. If you don't have sanitizer, you just use soap, then you wash your hands regularly. So I think George natitandiza because I was also against kuti muntu akasebenzisa kachaso maybe ngasebenzi.
Markets and bus stations are one of the places with high human traffic, making it a challenge to observe social distancing.
What do the people who work there day in, day out know about COVID-19?
COVID-19 tupaka chifine chironda pamkoshi umubiri ukukaba ero turayicingirira ife every Saturday ukufuna fepo yambira amarwere twisamukukirina nama mask turafara kwa nangu na mumbonefi cha nachiberera no kuberera no yamukefine nga wa palamina no muntu urwere COVID nga wakati ekintu nangu indara mefino muntu asa mukukushitana ayi wala COVID wasendenda na mashiretu wambukirwa balesa yaba healthy one time nali bamwene aba dot abakwanisha okuta mu roses batukwisa kwena balesa kutita sensitize then abakuntansi kumyesi no market twalikwata opotunga olengira market kwambira kulya kungira amabasi nga olengira make sure fire wachita sensitize fire bakusansi ngata kwete mask tabasuminisha okwingira nango mu market
ati matende chifine chifuba bamayambula mukutesemula mukukosomola na kutesemula but muno watu market kuli befe muno market tinkana clean every Saturday
kuli coronavirus muno station balafuta kwali kwata sanitizer kusamba kumalo bakungira muno mukati twasamba ta protect tubika pagano kwa mogula shana conduct ngana bakulipisha basi ila kuna wana ina kwata corona ka max ali kwata kuipa kaifucha kata uchingirire ulwele bula sometime wanasanga walalwa kata tulechina malwele yaya basanga twambusha kumunove ambusha kwa twambusha Zambia
Despite the knowledge about COVID-19, people in Zambian communities continue to downplay coronavirus.
Timavana ngataenda mu public places mu market monga ku town niyo pamanza kaida pakulibe bantu pafupi timaenda vita vakuti nga muli squeezed monga ku Soweto ndiye timavala.
What next for AMREF and civil society organizations in the new normal?
We've got to look after our own mental health whilst we can. So it's the small things, I would say. It's like making sure we have time to look after ourselves, talk to people. If you're in distress, talk to someone you trust. Try not to drink too much alcohol. Try and look after your eating habits. Eat a few, it's the sensible things that are sensible but actually can get lost when we are stressed or worried or overwhelmed. Talk and communicate, support each other. If you've got concerns with someone, your daughter, your girlfriend, your wife, hey, what's that? Let's talk it through. It's the small steps that will help us see through this issue, whether it's going for a walk safely, whether it's reading that good book, whatever it, cooking your favorite nshima the way you want it, whatever it is, I think will really help see people through. But I do agree. I personally find it hard when I think this is how it's going to be for a year. So I'm just thinking 1 week at a time. 1 week. We all have our own coping strategies, right? Take hold of them. But also, if you're struggling, reach out. Don't suffer in silence. It's okay to feel sad. It's okay to feel scared. Everyone has felt it at different times. We're all going on our own journey. So reach out.
I think we need to ride on it. Go out when it's necessary, and also if you go out, adhere to the public health guidelines. We've seen schools opening, and they strictly said adhere to the public health guidelines. And thankfully, we have not seen any cases yet coming from schools because we are seeing that adherence. Of course, in places like markets, there is issues of social distancing, which can rarely happen. But if we adhere to other guidelines, we will be able to, contain the virus in a way. If they put on masks, if they wash their hands regularly. Unfortunately, these are practices that we don't really practice here in Zambia, and it's going to take time for them to be practiced. But I feel we need the message that has been given should not change. We need to adapt to the new normal.
What are some of the successes has Zambia recorded in fighting COVID-19?
Number one, from inception, the health systems were configured in a manner to respond to a public health threat. And that again has to be attributed to the transformational agenda that President Lungu embarked on in the health sector prior, establishing a health security system that was alert enough to detect any public health threats. That's the initial success. Second success is a good plan, multi-sectoral and disciplinary in nature, that was highly sensitive in its surveillance and being able to detect cases in the communities at various ports of entry. Detection of these cases early formed one of the reasons why outcomes were good. Ability to manage them successfully, resulting in a very high recovery rate of more than 80%, is yet another success that we should talk about. We must also emphasize that research has been ramped up and we are doing clinical trials for various drugs that we've been using in response. And some of these research programs that we've been doing include prophylaxis research, seroprevalence surveys, and treatment research, like I said earlier on. We've also seen that there's been collaboration globally at regional and continental level, and our staff have participated in many programs at global and regional level. Zambia, the good leadership of His Excellency President Lungu has been identified, and Zambia sits on the continental body of the Africa Union that looks at the COVID response. So in all this, it is important to pitch the political will as extremely important, and in Zambia we boast of political will at the summit. And the President has led from the front line, and this is the reason why we've seen success. But like I said earlier on, it is not time for us to start celebrating success. It is time for us to sustain the gains and to push towards halting the COVID-19 outbreak. The number of cases that we were seeing when we ramped up our testing were alarming, but with increased testing, we're still seeing a reduced number of cases. That's a huge success.
Well, the beauty part about Zambia is we were one of the first to respond to our heads of states and government when they passed a resolution to create Africa Center for Disease Prevention and Control, Africa CDC. In their own wisdom, after that experience in West Africa of Ebola, our heads of state under the African Union decided to create a continental technical body. Operationalizing it, they created 5 regional hubs, of which one of them is in Zambia, which coordinates the SADC region. And they requested each member state to establish a dedicated institute responsible for health security. Our government took policy decision early and created the Zambia National Public Health Institute. So we are the disease intelligence responsible for the health security of the country.
We've also seen some successes with regards to what the government has been doing so far. We know that the government was proactive at the beginning. They set up a coordination mechanism even before we had the first case, just trying to prepare ourselves. I think this was at the time when the outbreak was declared a pandemic, and they put in place a coordination mechanism where we started preparing ourselves. We've seen also them developing an emergency plan where a number of strategies were outlined. Among them, there's the training of healthcare workers in infection detection, prevention and control. There's case management. We're talking about risk communication and community engagement. And also, we've also seen the ministry putting in place guidelines to enable the essential services to continue. So the cry at the beginning was that other services were being neglected, but the government has developed guidelines which should be able to guide health facilities in the provision of services. So we think that's a positive thing that has come from the government. We've also seen the government publishing on the donations that they have received over time. That shows some transparency in the resources that they are receiving. We're also seeing the government receiving partnership from the private and the public sector in terms of the response. So everyone has come on board to support this response to ensure that we're able to curb the pandemic. To be honest, we thought it would be worse, and the number of researchers that were coming out, it was actually estimated that we'd get to about 10,000 cases by May, June, but we are not there yet, so it means there is something going right somewhere.
Ones that have been successful now, I would say the screening at the international airport was well done, was very well done. Patients were screened there, they were taken to separate from other passengers once they were tested, if they tested positive, and then they were taken to the isolation facilities which had already been earmarked. So that particular part of the response, I think, was the most, the best part of our response. After that, I would say probably the way people were sensitized about hand washing, about preventing themselves from going out into crowds with people. That was also very well done, because just a few weeks or a week later, businesses were putting out chlorine for people to wash their hands. People are being sensitized on both radio and TV on how to prevent the spread of the coronavirus. So our preventative measures, I think, were in those instances were top notch.
And then in terms of the next steps for the civil society organizations and NGOs, I think is to continue complementing government's efforts. And also you realize that this pandemic was not planned. Most civil society organizations had actually not set resources aside to support this pandemic, but instead we had to realign the resources that we had. And so at some point they may run out. So we need to come up with strategies on how we can continue raising resources, or mobilizing resources to support the government's efforts. And also I feel there's need to invest into research to kind of back the interventions that are happening at the community level as well as at the national level. And also lastly, we feel the civil society organizations should also keep an eye there to ensure that the emergency response plan that has been put in place is clearly implemented and the people who need the services are receiving them. So we're also using the resources for the intended purposes.
Coronavirus is not a Ministry of Health problem, but yours and mine. Apparently, I'm a danger just like you are a danger to yourself and your family. So the onus is upon you to prevent the infection and the spread of COVID-19. Simply mask up, always wash your hands with soap frequently or sanitize, and also maintain social distance. Don't go out in public if you do not need to. Stay home and stay safe. From us from Diamond TV, thank you for watching. Goodbye.